Thank you, and good afternoon. During the last number of months, we've asked San Diegans to make tremendous sacrifice in an effort to protect life. We've asked people to stay at home, wear face coverings, wash their hands, maintain physical distancing. And as we begin the recovery process, we are continuing to ask for the public's help in our response. As Supervisor Cox mentioned today, our focus is on asking folks to give of themselves in terms of their blood. Anytime we have a natural disaster, a crisis, a public health emergency, where a large segment of our community is impacted, the usual blood donations and efforts at times can dwindle. They come in at a lower rate at a time where there may be a greater need. That is certainly true today. At the outset of our coronavirus pandemic, we saw a huge uptick in folks donating blood. There was a call to action. At that point, they were averaging about a 10-day supply of available blood. That is now down to a 2-day supply of available blood. And so we are asking San Diegans to continue to give of yourself a little bit more. The sacrifices we made in staying home are sacrifices that saved lives, a lot of lives right here in San Diego County. Now we're asking you to just donate a little bit of your blood. Again, a simple step and action you can take that also has the potential to save lives and help one another's. I know for years of my life as a Marine, and in particular in combat, we literally wore our blood type on our sleeve and written on our boot. I know how vitally important a available supply of blood is to our region, and so we are asking all San Diegans to reach out to the San Diego Blood Bank or the Red Cross and arrange a donation if you are able. It is something we can all do to help as we go through this. And then to reiterate the point that was made, there is, while we've often talked about the need for a vaccine or a therapeutic treatment, there are folks working incredibly hard on both of those, including around-the-clock effort and work around a therapeutic treatment, and particularly the possibility that was just talked about around using the plasma of individuals who have tested positive, taking their blood. I know Dr. McDonald, Dr. Infantides, Dr. Berg have been working with the San Diego Blood Bank on this innovative project that essentially can take the blood from anyone who has tested positive and recovered and utilize the antibodies created within their system to provide a form of therapeutic treatment and a form of help and assistance. The convalescent plasma donation is a way that, again, we can help one another. This program is limited to those who have previously tested positive. We are over 7,000 positive cases in our region that we know of. We are doing our very best to reach out to those 7,000 individuals. This is voluntary if they choose to participate, but it is something that we are raising attention about, raising awareness about, and if you're an individual out there who has received a positive test, we would encourage you to reach out to the San Diego Blood Bank, share with them your status, and see if you are a likely candidate in order to participate in this convalescent plasma project. We think that it has the potential to help our region and help us as we recover. So 2 ways every San Diegan can participate. If you haven't tested positive for COVID, we would like you to give blood. We need it on hand, and it helps our entire medical system and our entire county. If you have tested positive, we would like you to consider being a candidate to donate plasma because, again, we think that this has the potential and promise to help us. San Diego Blood Bank is a trusted partner. We are pleased to partner with them and work closely with them, and we appreciate all of their efforts and what they're doing, and you'll hear from their CEO in just a second. Before we bring him up, let's do a quick run-through of our daily metrics and charts, beginning with our testing, 3,699. Again, a little bit of a lag from some of the state sites reporting in, the state drive-up testing, along with the continued lag coming out of an extended holiday weekend. But we're now over 147,000 tests reported to us in the region, and our 7-day average is there about 3,800. Contact tracers in our tracing program, we're at 383 on hand and available, over 8,500 investigations performed. And then in our treatment, you see our public health motel rooms and the cumulative. Today we are reporting 117 new positive cases. This is out of 3,699 total tests reported, which gets us at 3%. Our rolling 14-day average is 3.1%, and so we are holding steady in that regard. Daily hospital census up a little bit, 156 in ICU, 408 total. Again, these are COVID-related hospitalizations. The orange number there is those who are in ICU. The blue number is ICU plus non-ICU. in our area's hospital systems. And then on the next chart, you can see where that 3,951 is relative to the 80% bed capacity that we are keeping an eye on a daily basis. The last one I have for you today is just our ICU utilization. Again, we shared this earlier. We're at 465 total in ICUs. Out of the 702 ICU beds available in our county, our ICU capacity would be 66% occupied as of today. Next, I want to introduce, to share more with you about the plasma donation program, the collaboration between the county and the San Diego Blood Bank. I'm pleased to introduce Dr. David Wellis, the CEO of the San Diego Blood Bank.